can you tell us what this NCCN panel, what it is about, and what is it like sitting in the room with all those 30 or so experts around the world and try to figure out the guidelines for treating melanomas?
Yeah, so the NCCN is a wonderful organization, a nonprofit organization, which disseminates evidence-based guidelines, and both online primarily now, but they host a series of conferences and symposia, and it's really about bringing together key opinion leaders and experts in the field from multiple different disciplines. So, of course, on the melanoma panel, it's, a privilege. I'm a medical oncologist, but we have dermatologists, surgeons, radiation oncologists, really all of the, expertise that would be involved in caring for a patient, with this disease, and in this case, melanoma. And we really aim to sort of synthesize the data and make recommendations that are available for review for other physicians, for learners, that are really evidence-based.
So how long was that process to, gather everyone? And do you guys meet virtually, or do you actually gather in one setting? Or how long did it take for you to review? I mean, there's a lot of data out there.
Yeah, it's a combination. Of course, COVID, has affected things, but we do still meet in person from time to time. Mm-hmm.
And so those guidelines are recommendations, or are they just sort of how does that work? What do most medical oncologists, or what do physicians, surgeons, how do they use this information?
The feedback that I receive from our partners in the community, in general has been very positive. I think people do use it as a reference and a guide. I think, obviously nothing replaces, clinical decision making and, best medical judgment, but they're there to serve as a roadmap, for practitioners. For example, someone who maybe doesn't just see melanoma, that may see many different types of patients with different cancers, and that may want kind of an update and guidelines. I think it's, can be an excellent resource.
All right. I'm glad we sort of clarify that a little bit, because I think it's a great resource for for physicians and for the patients to understand, what is the current state, what are the guidelines for treating melanomas.